People often ask me what the potential side effects of oral immunotherapy might be. So let's go through them one at a time. I would say that any time you take something that you're allergic to and you put it back into your body, you do run the risk of experiencing a systemic allergic reaction, also known as anaphylaxis. Anaphylaxis can be potentially life-threatening, so it's important to be aware that there is a risk of this occurring and to take steps to reduce that risk. We do this by having a ton of safety rules in place. This includes not dosing on an empty stomach, not dosing when you have a fever or are feeling ill, not dosing if your asthma symptoms are active, not dosing on the first 24 hours of receiving antibiotics for an illness, and not exercising for 30 minutes before or for 2 hours after a dose. If these safety rules are strictly observed, it significantly reduces the risk of experiencing anaphylaxis during food allergen desensitization therapy. Moderate reactions do occur, and this can include stomach pain or localized hives. Generally, we treat these symptoms symptomatically with increased carbs, more water, antihistamines, or GI protective medications as needed. However, all of these decisions should be made on a case-by-case basis in discussion with your allergist. The most common side effects that we see during food allergen desensitization therapy are gastrointestinal in nature. This can include transient abdominal pain, mild reflux, or sometimes kids feeling like they have to burp or they have a bubble stuck in their throat. Generally, these symptoms are always transient and self-limited and go away without intervention. However, there can be times when GI symptoms become more bothersome and more persistent. If this occurs, you need to let your allergist know right away, because it might be an indication that the patient is developing eosinophilic inflammation in their GI tract. One of the conditions that we look for specifically is called eosinophilic esophagitis. Eosinophilic esophagitis is an inflammatory condition of the lining of the esophagus where white blood cells called eosinophils accumulate in the mucosa. Symptoms of this condition include acid reflux type symptoms, difficulty or pain with swallowing, a sensation of things getting stuck in the throat, chronic abdominal pain, nausea, or even vomiting. Eosinophilic esophagitis is generally triggered by exposure to either food allergens or environmental allergens. So theoretically, it is possible that the process of food allergen desensitization and the exposure on a daily basis to the food allergen might uncover this type of inflammation in a patient who might already be genetically predisposed to it. The good news is that with reduction in the dose, treatment with appropriate medication, and a very gradual increase in the dose over a much longer period of time, a patient who experiences such GI symptoms is usually able to see resolution in these symptoms and continue on with desensitization therapy. However, in those patients who cannot tolerate this approach, it is possible to see a resolution of eosinophilic inflammation with discontinuation of food allergen desensitization therapy.